How to manage vertigo. Causes, symptoms, diagnosis, and treatment. Vertigo is a symptom characterized by a spinning sensation or a false sense of movement. It is often associated with disorders of the inner ear or the vestibular system, which is responsible for maintaining balance. Managing vertigo involves understanding its causes, recognizing the symptoms, seeking a proper diagnosis, and exploring appropriate treatment options. However, please note that it's important to consult with a healthcare professional for a proper evaluation and personalized advice. Before we begin this video, don't forget to subscribe to our channel for more daily tips like this and turn on notifications so you never miss our new videos. Please be aware that everything discussed in this video is unbiased, verified with facts, and approved by a licensed healthcare specialist before we proceed. In light of that, let's begin. Causes of vertigo. Benign paroxysmal positional vertigo, BPPV. Benign paroxysmal positional vertigo, or BPPV, is a common type of vertigo caused by the displacement of small calcium crystals in the inner ear. This displacement can occur due to factors such as aging, head trauma, inner ear infections, vestibular system disorders, or prolonged inactivity. BPPV is characterized by brief episodes of spinning dizziness triggered by specific head movements. Diagnosing BPPV involves physical examinations and positional tests to provoke vertigo and nystagmus. Treatment focuses on repositioning the displaced crystals through cannulate repositioning maneuvers like the Ablay maneuver. These maneuvers guide the crystals out of the semicircular canals, alleviating symptoms. Medications are generally not the primary treatment for BPPV but may be prescribed to manage accompanying symptoms. Meniere's disease. Meniere's disease is a chronic condition characterized by recurring episodes of vertigo, hearing loss, tinnitus, and ear fullness. The exact cause of Meniere's disease is not fully understood, but it is believed to involve abnormalities in the fluid balance within the inner ear. Factors such as fluid buildup, structural abnormalities, vascular changes, autoimmune response, and genetic predisposition may contribute to its development. Diagnosing Meniere's disease involves evaluating symptoms and medical history and conducting tests to assess hearing and balance. While there is no cure, treatment focuses on managing symptoms and reducing the frequency and severity of vertigo episodes. This can involve medications, dietary and lifestyle modifications, vestibular rehabilitation therapy, and in some cases, surgical procedures. Vestibular neuritis. Vestibular neuritis is a condition characterized by inflammation of the vestibular nerve, often caused by a viral infection. This inflammation disrupts the balance signals between the inner ear and the brain, resulting in vertigo and related symptoms. Risk factors for vestibular neuritis include viral infections, weakened immune system, previous respiratory tract infections, and certain environmental factors. Diagnosis involves a comprehensive evaluation by a healthcare professional. Treatment focuses on symptom management and may include medications and vestibular rehabilitation therapy. Recovery from vestibular neuritis can take weeks to months, and residual symptoms may persist but gradually improve over time. Labyrinthitis. Labyrinthitis is a condition characterized by inflammation of the inner ear, often caused by viral or bacterial infections. This inflammation affects the vestibular system, leading to vertigo and related symptoms. Other causes include trauma and inflammatory conditions. Symptoms include vertigo, dizziness, nausea, hearing loss, and ringing in the ears. Diagnosis involves a medical evaluation and possibly tests. Treatment focuses on symptom management such as medication and vestibular rehabilitation therapy. It's important to consult with a healthcare professional for an accurate diagnosis and appropriate treatment. Most cases of labyrinthitis improve over time, but recovery times can vary. Medications. Certain medications can cause vertigo as a side effect by affecting the central nervous system or the inner ear. Medications such as antidepressants, anti-seizure drugs, antihypertensives, sedatives, and ototoxic medications have been associated with vertigo. These medications can disrupt balance and spatial orientation. It's important to consult with a healthcare provider if you suspect your medication is causing vertigo, as they can evaluate your symptoms and make appropriate adjustments or suggest alternative medications. Abruptly stopping or changing medication without medical guidance is not recommended. Head injuries, tumors, and other less common causes. In addition to the previously discussed causes of vertigo, other less common factors can contribute to its development. These include head injuries, tumors affecting the inner ear or brain, multiple sclerosis, perilymphatic fistula, certain medications, autoimmune inner ear disease, infections, and vascular disorders. Diagnosing the underlying cause involves a comprehensive evaluation by a healthcare professional, and treatment varies depending on the specific condition. Now, let's go through the more established symptoms, diagnosis, and treatments. Symptoms of vertigo: spinning sensation or feeling off balance. Vertigo is characterized by a false sense of movement, such as spinning, rotating, or swaying. This sensation is often described as dizziness and can be accompanied by a feeling of unsteadiness or imbalance. Nausea or vomiting. Many individuals with vertigo experience nausea, which may be accompanied by vomiting. Severe dizziness and disorientation can trigger these symptoms. Sweating. Excessive sweating, along with feelings of warmth or cold sweats, can occur during vertigo episodes. The body's response to the disorienting sensation and anxiety associated with vertigo can lead to sweating. Abnormal eye movements. Vertigo can cause involuntary eye movements known as nystagmus. These movements may be rapid or jerky and can occur in various directions depending on the underlying cause of the vertigo. Tinnitus or hearing loss. In some cases, individuals with vertigo may experience ringing in the ears, tinnitus, or temporary hearing loss. These symptoms are more commonly associated with conditions like Meniere's disease or labyrinthitis. Diagnosis. When experiencing recurring or severe vertigo, it's important to seek a proper diagnosis from a healthcare professional. They will evaluate your medical history, conduct a physical examination, and perform specific tests to determine the underlying cause of your vertigo. The following are some common diagnostic methods. Physical examination. During the physical examination for vertigo, healthcare professionals assess the patient's medical history, perform a neurological examination, examine the ears, evaluate eye movements, assess balance and coordination, and measure blood pressure. These assessments help identify potential causes of vertigo and determine if further diagnostic tests are needed. Patients need to provide accurate information and communicate their symptoms clearly during examination. Medical history. Medical history is an essential component in diagnosing vertigo. It involves gathering information about the patient's vertigo symptoms, including their description, onset, progression, triggers, and associated symptoms. The healthcare provider also reviews the patient's medical history, including any past episodes of vertigo, relevant medical conditions, medications, and family history. This information helps informing a differential diagnosis and determining the appropriate diagnostic tests or referrals. Patients should provide accurate and comprehensive details during the medical history assessment to aid in an accurate diagnosis. Dix-Hallpike maneuver. The Dix-Hallpike maneuver is a diagnostic test used to assess vertigo, specifically benign paroxysmal positional vertigo or BPPV. It involves moving the patient's head and body into specific positions while observing for vertigo symptoms and characteristic eye movements called nystagmus. The test helps determine the presence and location of BPPV. It should be performed by a trained healthcare professional. If you suspect you have vertigo, it's important to consult with a healthcare provider for an accurate diagnosis. Other specialized tests. Specialized tests such as electronystagmography or ENG, videonystagmography or VNG, rotary chair test, hysterography, and evoked potentials can aid in the diagnosis of vertigo. These tests assess the functioning of the inner ear, balance system, and neurological pathways. ENG and VNG evaluate eye movements to determine the origin of vertigo and identify inner ear abnormalities. The rotary chair test measures the vestibular system's response to rotational stimulation. Posterography assesses balance and postural stability. Evoked potentials measure electrical signals to evaluate auditory and vestibular pathways. These tests provide valuable information and are conducted by specialized healthcare professionals. The specific tests ordered depend on the patient's symptoms and suspected underlying causes of vertigo. They assist in diagnosing and guiding appropriate treatment for vertigo. Treatment. The treatment for vertigo depends on the underlying cause and severity of symptoms. Here are some common approaches. Canalith repositioning maneuvers. Canalith repositioning maneuvers are a series of specific head and body movements designed to move the displaced calcium crystals or otoconia in the inner ear back to their proper position. The most widely known maneuvers are the Epley maneuver and the cement maneuver, which are used to treat benign paroxysmal positional vertigo or BPPV. Medications. Depending on the cause and severity of vertigo, medications may be prescribed. Antihistamines such as dimenhydrinate or meclizine can help alleviate dizziness and nausea. Anti-nausea drugs like promethazine or ondansetron can be used to manage severe nausea and vomiting. Benzodiazepines such as diazepam or lorazepam may be prescribed to help relieve acute vertigo symptoms. For individuals with migraines associated with vertigo, specific migraine medications like triptans may be recommended. Physical therapy. Vestibular rehabilitation exercises performed under the guidance of a trained physical therapist can help improve balance and reduce symptoms of vertigo. These exercises aim to promote compensation for inner ear deficits and enhance the brain's ability to adapt to changes in balance signals. They may include gaze stabilization exercises, balance training, and head movement exercises. Lifestyle and dietary changes. Making certain lifestyle modifications can help manage vertigo, particularly in cases of migraine-associated vertigo or Meniere's disease. Managing stress levels, practicing relaxation techniques, ensuring adequate sleep, and avoiding triggers such as certain foods, caffeine, alcohol, salt, or activities that worsen symptoms can be beneficial. It's important to work closely with a healthcare professional to determine the most appropriate treatment plan for your specific situation. They can provide personalized advice and guidance based on the underlying cause of your vertigo, the severity of your symptoms, and your individual health needs. As always, we care about your health. If you enjoyed watching Vital Health TV and learned something from this video, please hit the like button and subscribe to our channel for more videos like this. Thanks for watching.